The snip.
Sacupuncture.
Shooting blanks.
Empty coin purse.
Going wireless.
Buying frozen peas. Hi, I'm Dr. Emma Boulton. I'm the Director of Clinic 66, which is a one-stop sexual health practice in Sydney, Australia.
Hi, I'm Deborah Bateson. I'm the Medical Director at Family Planning New South Wales. And I'm very excited that we're approaching World Vasectomy Day and we're going to be providing bulk billed vasectomies with Clinic 66 in Dubbo on the 19th and 20th of November. So vasectomy is a very simple procedure. So it can be done just in a clinic setting. It doesn't have to be in a hospital. And we use the no scalpel technique. It's a very gentle technique, and this occurs under local anaesthetic, and it's really well tolerated by men who have made that decision to come and have a vasectomy.
When you have a vasectomy, all we're doing is stopping sperm from getting into the semen, which is still produced naturally.
So one of the myths of vasectomy is that it's easily reversible, and we really have to say to people we can't guarantee reversibility. Sometimes we hear about men who do have the microsurgery to put the tubing back together. Sometimes we can take sperm out of the testes directly, but we can't always guarantee a pregnancy after that. So you have to see it as a permanent method. 1
in 4 men in Australia has had a vasectomy, and behind New Zealand, that's some of the highest per capita rate of vasectomy in the world, which is a fantastic achievement because many men feel that it will somehow impair their virility or their sexual performance, which is simply not true. In fact, many men say that their sex life improves after a vasectomy because they're no longer afraid of impregnating their partner and getting them pregnant.
So we know that some men can feel a bit frightened about a vasectomy, and we know there's lots of myths out there, but it really is a very simple, straightforward procedure. You'll get lots of information, and we know that you'll be supported to get back to work as soon as possible. So it's a great option.
Well, like any a procedure where you make a small nick into the flesh, there's going to be a little bit of bruising and a little bit of swelling, and it's going to be uncomfortable for a few days. And with a vasectomy, it's important that you have your expectations set at the beginning.
So vasectomy is a very simple procedure. It takes around 20-30 minutes. You can have a bit of bruising afterwards, and certainly most people can go back to work actually on light duties the very next day. It depends on your work. If you're doing heavier work, then sometimes you do need to wait a bit more time.
It's pretty straightforward usually, but it's important to manage your expectations and try not to do too much too quickly.
So it's really important to know that a vasectomy is not immediately effective. You do need to wait for it around 3 months until you've had a sperm count which has 0 sperm in it. And that's because there's sperm in what we call the distal part of the tubing, so that's all got to come out. And it's really important that you use another method of contraception. We've thought about this beforehand for that time frame until we can be sure that this is now an effective method of contraception.
So a semen analysis will be done 12 weeks after the procedure, and once it's been confirmed that there are no longer sperm left in the semen, then you can be sure that there's more than 99.5% chance that it will remain effective as a permanent form of contraception. This is another myth because actually many men say that their sex life improves after a vasectomy. After the initial recovery time, we usually recommend you wait about 5 days before starting to ejaculate again. And then after that, if everything feels comfortable, you can resume normal sexual activity. It doesn't affect your ability to have an erection, your arousal, your performance, your climax. None of those things are affected because it doesn't affect your testosterone levels. All we are doing is stopping sperm from getting into the semen.
It's really important not to do too much too soon, just in terms of lifting heavy weights, for instance. And that's because sometimes we do have a few little sutures around the site, and sometimes that can cause them to be disrupted, so you don't want that. And also then you can potentially develop what we call a scrotal hematoma, which can be a little bit painful. So it's really important to just stick to those rules, and then everything will go well.
So there's been no conclusive evidence in the published research to suggest that there's any link between vasectomy and cancer. There are small risks associated with having a surgical procedure, as there are with any surgical procedure, but once the procedure has been done, it's highly unlikely that you'll get any long-term consequences. So, loving the time of COVID, this is a fantastic opportunity to celebrate the health and well-being of the people of New South Wales, and we're so excited to be able to work with family planning on this joint outreach venture, and I look forward to seeing you in Dubbo.